This is Katrin with Disability Rights New York. Welcome to our podcast, Empire State of Rights Closed Captioned. We are here to bring you information on the most relevant topics regarding disability rights and advocacy. Today, we welcome DRNY's Executive Director, Tim Clune. He's here to talk about Disability Rights New York's 2021 highlights. Hi, Tim. How are you doing today?
I'm doing really well. Katrin, how are you?
I'm great. Thank you so much for joining us today. 2021 was certainly another big year, and obviously COVID-19 continues just to be a part of every conversation and the news that we're seeing still. Talk to us a little bit about the continuation of COVID-19, not only for the entire organization and DRNY staff, but also the community that we serve.
We have been, as you know, remote since March of 2020, and it is unthinkable that we're coming upon 2 years as we move into 2022. But what I want to say is our staff have been resilient. They have been creative in ensuring that we are able to continue to do our job. This year, we had high hopes that we would be able to get back into the office, that we would be able to work together. But with the advent of the Delta variant and now the Omicron variant, those decisions have now been backburnered, at least for a little while. However, it really hasn't stopped us from doing the work that we're charged to do. And in fact, we've been producing more and more work this year than I think we have in others. Before I get into all of the things that we've done this year, I'd like to just recognize that in 2021, DRNY celebrated its 8th anniversary as the Protection and Advocacy and Client Assistance Program for New York State. So that is a really, really nice milestone for us. And during this year, we've addressed COVID in many different ways. We continue to provide services directly to our clients through email, through phone calls, through Zoom calls, and at times we have met with clients, safely in the community. Additionally, this past year, we received a grant to help provide information to the community regarding vaccinations. And as part of that grant progress, we were able to hold community events where we were able to provide information to the community regarding the vaccination. And more specifically, and this is a very, very impressive accomplishment that we combined with the organization Ibero as well as the University of Rochester to hold a forum completely in Spanish so that we could provide information to our communities regarding their specific questions about the vaccine. And we're continuing to look at providing other culturally competent presentations in those communities as well.
We certainly have been putting out a lot of information. And as you said, not only monitoring COVID and the variants that are happening and having the staff in the office continue to just move along and now bring out information as far as the vaccine and the boosters as they've happened. And along with that, we have some major cases that we're still working on. Let's talk a little bit about those, and any ones you want to start with first. Let's talk about those.
Well, we can move back to the beginning of the year. So back in January of 2021, we filed a lawsuit against the New York City Board of Education, the District 75 case, which had emanated out of Staten Island. And I will circle back to the Staten Island component in a little while. But what we were finding is that children with disabilities were being segregated into classrooms away from their peers across the county. So we had brought a case in early of 2021. That matter is still continuing, and we are hoping that we will get some resolution in the near future. The Department of Correction and Community Services, DOCS, has been on our radar, and we have been fighting with them for years. And we've had to file 3 lawsuits against them. Those cases are pending. We had just filed our brief to the Second Circuit Court of Appeals regarding the creation of impediments to our accessing our clients as well as the records of our clients. But I think one of the main accomplishments in 2021 was that we were able to settle the nationwide lawsuit against Dollar General stores. Now, these stores are often located in rural areas and often are the only game in town when it comes to providing household needs, everyday needs, including food, to people in those communities. And what we had found over the course of an investigation was that Dollar General was just stacking up all of their merchandise in the aisles, which created a physical impediment to people who use wheelchairs or other assistive walking devices to move freely through their stores. And in fact, sometimes people could not even get down the aisles to do the shopping that they needed. As part of the settlement with Dollar General, we will be monitoring Dollar General stores across the country to ensure that they live up to their obligations in this settlement to make sure that their stores are physically accessible to our clients.
That really was such a big case. And when we think about it as far as a nationwide effort now to monitor these stores, and that it started here with DRNY, I think that that's something that is not only impressive to us as an organization, but to our audience as well. And along with these cases, we also published some pretty significant reports. I think about the RASIC report that we worked on with the Mental Health Recovery Research and Natal Racial Justice Research Labs at John Jay College. And this was one of our systems in crisis reports, identifying critical issues in response to mental health crisis calls. As we look at the news, it's happening, unfortunately, all too often. Tim, why is it so important that DRNY addresses mental health crisis calls? And how does it affect our community specifically?
Well, we have seen the effect in our communities, unfortunately play out in fatal ways. Daniel Prude was gunned down in Rochester. He was someone who needed assistance. And in fact, his family had called for assistance for him, and he ended up dead. What we've identified, as well as our colleagues across the country have identified, is that police response to mental health calls and to people who are in crisis is really not the way we should be addressing this issue. This is about providing services and safety to our clients in these particular situations. And unfortunately, the police response, they are just not qualified to provide these services. They approach these calls as our clients are criminals, when in fact they are in the throes of a mental health crisis. So there needs to be a highlighting of this problem, sharing it far and wide, and then getting to the table to discuss how we can make a difference in future responses to these mental health crisis calls. So in addition to the report that we had issued, we had also participated and were at the table for the New York State Bar Association's task force regarding police interventions with people with disabilities as well as people of color. And it was important that DRNY be at the table, and we will continue to assert our responsibility to be at these tables so that we can discuss these issues and bring a perspective that is often not presented during these types of task forces. Oftentimes, people with disabilities are the last to be considered, but the first to be impacted by a lot of the policy initiatives that come out of our local and state government.
That's a great segue into our next report and talking about how the disability community has been so severely impacted by policy regarding COVID-19. We published another report along with the New York Civil Liberties Union, NYCLU, and New York Lawyers for Public Interest, NYLPI, titled New York State's Response to Protect People with Intellectual and Developmental Disabilities in Group Homes During the COVID-19 Pandemic. Tim, this report outlined how COVID-19 impacted people with IDDD and really how New York State failed to be transparent about information regarding the number of cases as well as deaths in this community. Talk to us a little bit about the report and what, if any, changes have we seen as a result of it?
Well, this was a report that was so necessary early on in the pandemic, and as we have followed in the news, New York State's failure regarding nursing homes was getting a lot of press, and rightfully so. What we found was that people with intellectual and developmental disabilities living in group homes were being ignored. And we know that to be so. People living in these group homes, they were not designated for PPE necessary to ensure that COVID-19 during the early months was not so easily transmitted among people living in the home, as well as staff, and as well as staff going from one home to another. So we were able to publish this report that found, among other things, that people living in these group homes were 3 times more likely to be infected with COVID and 3 times more likely to die from it. Those are remarkable numbers, and New York State needs to do better on that. As a result of our report, we were able to get good press coverage on this, but more importantly, we participated in New York State Senate roundtable presentation regarding the results of our report, and we are pressing our legislature to make sure that this does not happen again in the future. As we are almost 2 years into COVID, it doesn't appear to be going away ever so quickly, and we need to be vigilant to ensure that people living in congregate care are not going to be in a situation where their life and death is on the line every single day because the state hasn't provided the appropriate protections for them. I think this also is highlighted for us as the P&A that reliance upon congregate care settings is just an outdated mode, and that what we need to be doing is to ensuring that people who want to live in the community can live in the community, and the resources need to be redirected so that can happen.
Absolutely, Tim. I love doing these year-end podcasts with you because I feel like there's so much. We could go on for hours, I feel like, with all of the things that we've done. But for time's sake, let's keep it a little bit shorter. And if there's anything else that you would like to talk about before we sign off today, what would you like to share?
So the way we receive our cases, people contact us. That is a primary way for us to know what is going on in the community. And I just want to share some numbers with you. This past year, in looking at the numbers, we've received approximately 6,500 requests for services. And these calls come into our intake department. And our intake department provides stellar responses. And what we have seen is they can help out in situations where maybe we are not able to devote significant resources for a particular matter. But more importantly, what this has shown to me is that I need to increase the resources here. So currently we have 4 intake specialists who handle all the requests that come in. We are going to add an additional intake specialist in 2022, or as soon as possible. So what I would put out is, if you know anyone who wants to join DRNY to make a difference for people every single day, please send them our way. This is a rewarding job. It is a tough job, but at the end of the day, you get to put your head down on the pillow and feel like you have really made a difference for people in the state of New York.
That is such great news, and what a big announcement. We will put the link to the employment page for our website in the comments of this podcast, and that way people can easily access the application. Tim, thank you so much for your time today, and we look forward to talking to you again in 2022.
So do I. Have a great day.
Empire State of Rights Closed Captioned has been brought to you by Disability Rights New York, your source for disability rights and advocacy. If you enjoyed our program, make sure to subscribe, like, and share this post. If there is a subject you would like us to discuss, please email podcast@drny.org or comment below.
This will be the final episode for our 2021 season. We would like to thank each and every one of you for following our podcast. We will return on January 12th, 2022, to bring you more information on disability rights in the state of New York. So make sure you tune in.
The closed captioned and ASL version of this podcast is available on our YouTube channel. To listen to more Empire State of Rights closed captioned, follow us on Apple Podcasts and Spotify.